Good afternoon, everybody, and welcome to our back to school to geriatric medicine town hall. We're having beautiful weather with beautiful sleeping weather at night down to the 50s. So hopefully you're all able to open your windows and enjoy that. Got a great core topic in geriatric medicine to talk about today. And I will pass the baton over now. Oh, sorry, I should probably introduce myself. I'm Matt Russell. I'm the clinical director of geriatrics here. And I'm going to introduce our moderator, who you all know well, Susan Edgman-Levitan, who is the director of the Stokely Center for Primary Care Innovations.
Thank you. Thank you, Dr. Russell. So before we get started, I'm going to go over a few housekeeping rules. Everybody is muted on the call except for the speakers to help eliminate any background noise. When we begin our formal presentations, you can view the speaker on your full screen, or you can go up to the upper right corner and click on Gallery View, which allows you to see the speaker and then all of the participants who are with us today. If your picture becomes jumpy or out of sync, please go down to the lower left corner and you can click on the little video icon to stop your video, because that sometimes helps speed up your connection. For questions, please use the chat feature, which is right in the middle of the bottom ribbon across the bottom of your screen. But I just want to remind people that we really do not want you to add any personal medical questions, because anything you put in the chat can be seen by everyone. So you can ask medical questions, but it's not a time to get personal medical advice for you. And for that, we really encourage you to reach out to your doctor. And we usually have time to answer all the questions. We'll do our best. And so before, I'm going to move right to introducing our speakers today. So we are very lucky to be joined by a group from the Active Brain Study at Mass General. And you're going to hear from Dr. Ryan Mace, who is a clinical psychologist and is part of the Choir Center at Mass General in the Department of Psychiatry. And then we're going to hear from Dr. Esteban Franco Garcia, who is one of our geriatricians. And he is going to be talking about fall prevention and falls. And I know we've already gotten a lot of questions about that. And Dr. Garcia is an associate physician in the Department of Medicine at Mass General and an instructor at Harvard Medical School. And he specializes in the care of older adults with orthopedic trauma. He also serves as the medical director for the Geriatric Inpatient Fracture Service, the GIFTS program, where he helped develop and enhance clinical outcomes for older adults with fractures. And his leadership in geriatric orthopedic co-management has been recognized for reducing postoperative complications, hospital length of stay, and mortality among the population of people who unfortunately have some sort of fracture. He also is deeply involved in our educational and quality improvement initiatives and is the Geriatric Medicine Fellowship Program Director at Mass General and the Quality and Safety Director for the Division of Geriatrics and Palliative Care. So I'm now going to turn this over to Dr. Mace to share some information with you all about a new study that might be of interest to people on the town hall. And he's actually going to put information in the chat where you can learn more about this if you're interested in. So Dr. Mace, please go forth.
Thank you so much, Susan, and nice to meet all of you. I really appreciate the opportunity to be here today and very briefly plug the Active Brains program that we're running. We've been doing for many years here at Mass General Hospital, and I'm here with some of my team members as well. If you're interested, you'll be working very closely with us throughout the stages of the project. Do you guys want to introduce yourself very briefly? Du Mitchell?
Hi, everybody. My name is Du Mitchell Harley. I'm one of the study clinicians that's a part of the Active Brain Study, working in the group sessions, especially trying to garner a good group environment, teaching about memory-related problems, pain, and how we can best handle them. Nice to meet everybody.
Thanks, Du Mitchell. Elizabeth and Daphne?
Hi, everyone. My name is Elizabeth. I'm one of the clinical research coordinators on the Active Brains team. I'm the person who's answering and making a lot of calls to our participants, checking in and helping them move through the study.
Hi, everyone. Lastly, my name is Daphne. I'm also a clinical research coordinator on the project, and I basically also do the daily calls, the day-to-day tasks that we have, the same thing as Elizabeth.
Thanks, everyone. So now that you met our team, you're probably wondering, well, what are we all about, right? So, you know, we all know that problems like chronic pain and memory loss are big concerns as we get older. So some of you may be experiencing this right now or have some loved ones that have one or both of these concerns. But we often don't really talk about how pain and memory problems are actually connected to one another. So for example, pain can really influence how we think, right? When we're in pain, it's really difficult to focus on something else because it's taking up our entire attention. And when we have memory issues, it can make it difficult to make medical decisions and manage pain. And when the two of them happen at the same time, they can really feed into one another and make them worse. And we really don't have good treatments, unfortunately, to address this, what we call comorbidity, when pain and memory problems are present at the same time. And so this is why we really launched the Active Brains program. What we're hoping to learn is how we can teach folks ages 59 and older how to manage memory problems of all types and different types of pain as well. Get some relief and hopefully get back to activities that you enjoy. And so what we're doing, we've been over the past few years, is running virtual groups of Active Brains. We're looking at two different ways of tackling pain and memory problems. One of them focuses directly on some of those strategies for managing pain and memory issues that our clinician Mitchell mentioned. Another one introduces walking and physical activity as another form of managing those two concerns. They both are pretty brief. They're about an hour and a half a week for 8 weeks. And we meet in groups just like this on Zoom. And everybody gets a watch that they can use that helps us kind of track changes over time in the program. It's done completely from home. There's a few periods where we'll ask you to complete some surveys, and Elizabeth and Daphne will walk you through all of those steps of the process. So in addition to getting a treatment, we are also contributing to research and best learning how we can manage memory problems and pain as we get older. So if this is something that you're interested in, or even if you have some questions about, Elizabeth and Daphne will drop the program information in the chat, and we're happy to speak with you and see if this is a good fit. And if this is a conversation of interest in general, we're hoping to come back to a later town hall and talk about memory loss, memory concerns, and pain more in depth. Thank you so much.
Thank you. And I think we would definitely like to have you come back because I think we could all learn something. So thank you. So, Dr. Franco Garcia, I think we're ready to hear from you about falls.
Wonderful. So welcome, everybody. And first of all, I want to thank Susan and Dr. Russell for the invitation to talk at this town hall. Let me share my screen. Okay. So I hope that everybody's being able to look at my slides. So as Susan mentioned in my introduction, my clinical work is the inpatient service dealing with the results of falls. Unfortunately, as we're going to see over the next few minutes, this is a very common condition that, you know, it can lead to severe injury and severe decline in function. So it's a topic that is very near and dear to my heart, and that the best we can do is to try to prevent this from happening to begin with. So here's a statistic from the Center for Disease Control, the CDC, where every 20 minutes an older adult dies from a fall or injuries related from a fall, and many, many more will get injured. So my objectives for this hour is so that we can all learn about the importance of falls in older adults, how to identify risk factors, and then how to implement a prevention plan to try to, again, prevent this from happening in the first place. So let's talk a little bit about background first. So falls is one of the most common geriatric syndromes. And this is a very important point to make, as even though falls are very common, they are never a normal part of aging. So if you are someone who has experienced recent falls, or you know somebody who does, even if you think this was a silly accident, or you tripped on something, or you were not paying attention, and you think it's not going to happen again, you should always consider falls as a red flag and something that you need to talk to your doctor about. And we'll talk about this more. And certainly falls are not a normal part of aging. Again, they're very common, but they're never a normal part of aging. So a question for the group: what is the most common source of injuries in older adults? So if you're thinking falls, then you're right. That's why we're here for. So fall, this is a chart. It's a little bit of a busy chart, but I think it does underscore the importance of what we're going to talk about. So in this chart over here, what you can see is in the different colors are the different sources of injury in people from any age. Here on the left side of the graph, you can see age 0 to 10, and then as you start getting older, you can see on this side the number of cases. And as you can see, falls is this blue line. The falls are very common in young adults or in young people. As a matter of fact, my own 11-year-old kid just fell this morning. I had to pick him up from school, and he injured one of his ankles. But then as you grow older, motor vehicle accidents become the most frequent source of falls. That's that line in red that you can see. But then after the age of 50, 55, you see how the blue line starts going up again, especially when you're in your 70s and 80s, it becomes very prevalent. So each year, about 30 to 40% of older adults will experience falls, and about 75%, so the majority of those falls occur at home. I'll tell you a little bit more statistics about falls. So there's about 12 million falls in the US every year. Out of those, about 60% of the patients will fall again after a first fall. About a third of those patients will restrict their physical activity. And even though most of the falls will result in minor injury, about 10 to 15% result in a fracture, about 5% will result in a major head trauma, and about 2% of those will result in injuries that will lead to death. So why else care about falls? Let me show you a few more statistics, and I promise this is all these statistics for this morning. About 25% of people, so a quarter of them, will become more dependent in their activities of daily living. There's an increased use of medical services and increased nursing home placement after injuries related to fall. So about 3 to 4 times more likely to end up in a nursing home. And about 40% of patients will going to have significant pain that could lead to chronic pain after injuries related to falls. Then there's also the psychological effect of falls. There's this thing that we call the fear of fall cycle, where somebody falls, then they start worrying a lot about having another fall, which leads to patients or people decreasing their mobility, which again leads to increase in muscle weakness, which will lead to more falls. So I hope I made the case of why it is important to talk about falls, to think about falls. So now let's talk about what makes us fall. So falls are often due to multiple factors, and they're rarely due to any single cause. It's often a complex interaction of risk factors, for example, like age-related changes or chronic diseases, which we'll talk a little bit more in a minute. And it's also about mediating factors, so external factors, risk-taking. We'll also talk about that. So these are some of the common risk factors for falling. As we get older, there's some usual changes in many of our bodies, different systems that can increase our risk for falling. For example, there are neurologic changes in where our ability to react from tripping on something, or like our reflex slow down. So if you trip on something when you were younger, it's more likely that you're able to, by reflex, just correct your position and not fall. As you get older, these reflexes start slowing down, so your risk for falling increases. There are also several neurologic chronic medical conditions that can increase the risk of falls. For instance, hydrocephalus, normal pressure hydrocephalus, Parkinson's disease, and different strokes can increase your risk of falls. In the musculoskeletal system, there are some changes where your gait and your muscle strength decreases. There's also a lot of prevalence of osteoarthritis, where your joints swell up and they hurt, so that increases also your risk. There are some normal visual changes as well as you get older. Some of us will have decrease what we call accommodation, or decrease dark adaptation, in where, for example, if we are in a very bright room and we go into the next room which is very dark, it takes longer for our eyes to adapt to that change. So if there's something in the floor that you don't see, you can trip on it and fall. And the other way works well as well. If you're in a dark room and you go out, or you go to the next room which is very light and bright, your eyes are going to take a little bit longer to adapt, and you're going to have a decreased vision for several seconds. There are some also age-related diseases from your vision, like cataract or glaucoma, that could also increase your risk of falls. And then there are the cardiovascular changes. People are more prone to dehydration, which increases the chance of a lower blood pressure when we change position from sitting to standing. Hypertension is also a very common disease as we get older, and a lot of us have to take medications for controlling the blood pressure. And as we'll see, many of these medications can increase our risk for falls. So a little word about medications. As we get older, medications in our body can have different effects. Some medications, or combination of medications, can make us sleepy, dizzy, lightheaded, and can cause us to fall. It depends on the specific classes of medications. So there are blood pressure medications, there are antidepressants, sedatives, antipsychotics, heart medications, diabetes medications that can some way or another increase our risk for falls. Again, as we get older, our kidney function, our liver function changes, so the metabolism of these medications changes, as well as any recent adjustment in doses or medications. We often tend to be a little more sensitive about these changes. The more medications that we take, the higher the chances of interactions between these medicines. So it's very important to keep this in mind and always talk to our doctors about this. Also, as we get older, our body uses more energy and resources to keep us in balance. When we get sick, for instance, if we have an acute infection, if we have a pneumonia, a new heart problem, our body's energy gets used more to fight this new change, and that increases the risk of falls, and increases the risk of put us out of balance and result in a fall. So always keep this in mind. Even if it's a common cold that you're having, that whenever you are acutely ill or sick, you are more prone to falling, and you have to be more careful about fall prevention. So these were the intrinsic risk factors for falls. Now let's talk a little bit about the environmental hazards. So this little cartoon is a little bit of an exaggerated picture, but I think it illustrates well the many hazards of falling. For instance, stairs without the proper handrails, or bathtubs without the proper handrails to get in and out of the bath, electrical cords, clutter around the house. Some people who need to wear oxygen at home often trip on their oxygen line. Inappropriate lighting, as we were talking about our vision changes. If you don't have good lighting at home, or if let's say you need to get up several times during the night to go to the bathroom. If you don't turn on the lights, even though you've lived in the same house for many, many years and you think you know your way around it, it is always important to keep bright lights whenever you are getting out of bed. Also, having inappropriate footwear. In this cartoon, you'll see both the gentleman and the lady are using shoes or slip-flops or without any proper heel support. So having the appropriate footwear can also increase your risk. Loose rugs, we all have rugs in our home that are not necessarily properly adjusted to the floor. So you can always trip on little folds or on the rug, and you can't imagine how many patients do I get with hip fractures that they trip on a rug that shouldn't have been there to begin with. Also, inappropriate or incorrect use of assisted devices. If you use a cane or a walker, sometimes if it's not well adjusted, if the height is not good, or if you're not really using it appropriately, it can also increase your risk of falling. Okay, so now let's talk about how to prevent falls. And what I'm going to tell you are 4 things that you can do to prevent falls. So first, talk to a provider, your doctor, nurse practitioner at your practice right away if you've had a fall, if you're worried about falling, or if you feel unsteady when you walk. Also, as we talked, have your doctor or pharmacist review all of your medications you take. Even the over-the-counter medications are important, but always talk about this with your providers if you're worried about falls. Second, exercising. Exercises improve balance. It make your legs stronger. It lower your chances of falling. It also helps you feel better and more confident. A good example of a good exercise to increase or help with your balance is doing Tai Chi. And as we mentioned, lack of exercise leads to weakness. It leads to increase your chances of falling. So ask your doctor about what's the best type of exercise that is appropriate for you. And as well as be aware that there are several community resources that can offer specific programs for older adults. And actually, I'm going to put in the chat a few links to community resources that you can check out for special exercise programs. Just give me 1 second, and then, okay, there they are. So look in the chat, and you can open those and look at them after this talk with a little bit more detail. Third, once a year, in your doctor's check, always check in with your eye doctor and update your eyeglasses if it's appropriate. Talk with your eye doctors about, if you have any specific conditions that may increase your risk of falls. Also, with your primary care doctor, discuss, have them check your feet at least once a year and discuss what are proper footwear and whether or not it would be important for you to see a podiatrist or a foot specialist. And then finally, make your home safer. There's many different ways that you can make your home safer. One of them is using the following checklist. This is an example of a checklist that is available at the CDC website. I'm going to post also the link for that checklist here in the chart. I'm not intended to, or I'm not going to review this whole checklist with you guys right now, but sorry, as you can see, it's something that you or your caregiver or a family member or a friend can go through and make sure that different areas in your house are safe and to decrease the risk of falls. Also, for some people who might be appropriate, in discussion with your doctor, they can make a referral for an occupational therapist to do a home visit, in where they will do like a more professional evaluation of all of your house and your environment and make some recommendations of modifications that you can make to make it safer. One quick word about a long lie. For those who don't know, long lie is when you fall and you can't get up, and then there's nobody around that can help you, and it could pass several hours between somebody helps you, and that this is associated with a myriad of complications, including muscle injury, skin injury, even kidney injury that could lead to more complications. So on people who have frequent falls or who have a lot of risk for falling, the use of personal alarms are recommended. As you can see in this picture, there's lots of different brands and types of personal alarms. Some that you can wear around your neck, some that you can wear around your wrist. Some of the newer smart watches have fall sensors. So if you think you need it, use it, and use it as appropriate. Because I've also had several patients that they have these alarms, but they keep it in the drawer, or they keep it hanging from their bed headboard, where, you know, if they fall in the kitchen, they're not going to be able to reach for it. Another way is, you know, you can find somebody, a good neighbor, a friend, a family member who can do frequent check-ins with you, and every few hours or several times a day, just give you a call and check in if things are going okay. All right, so this brings us to the end of our talk. I want to make sure that we have enough time for questions, but I do want to leave you with the summary so that you don't fall for these hazards. So clutter, we talked about this. Keep your home and workplace, you know, free of clutter that, you know, you can trip over. Don't fall for scary staircases. So make sure that you have the appropriate rails or handrails or modifications that you need to go up or down stairs. Don't fall for the dark. Again, we have some normal visual changes as we get older that, especially in dark rooms, we're not able to see as much, and we're not able to see a lot of contrast. So be careful about this. Don't fall for things in high or low places. So what we typically recommend in areas where you, especially like in the kitchen, that you use a lot of things, try to store them in areas that are at your waist level. If they are too high that you have to reach up, and then you have some arthritis, or then you have to stand on a stool to try to get them. Or if you store things in very low places that you have to kneel down or bend down to pick them up, that can increase your risk of falling. Don't fall for medication side effects. Again, review your medications with your doctors. Every time you're changing the dose of a medication or starting a new medication or considering an over-the-counter medication, check in with your doctors or your pharmacist and make sure that that's safe. And finally, don't fall for your pride. We all have the dignity to take our own risks, but, you know your physical limits. Don't get on that ladder if you don't think it's safe anymore. Use assisted devices appropriately. If your doctor has, been telling you for quite some time that it would be better if you use a cane or a walker, a lot of us don't use it because we just won't like to be seen using these type of devices. But it's better to use that than ended up in the ground with a broken hip, and it's downhill from there. So thank you everyone for your attention. I'll stop sharing my screen here and open for any questions from the audience.
So we don't have any questions in the chat, but I have a couple of questions. Can you say a little bit more about specific medications or types of medications that put people at higher risk for falls?
Absolutely. So there's different classes of medications. The ones that have the higher risk of falls are any medications that could make you a little bit more sleepy, or sedatives. There's several classes of medications that can give this. There's just like any medication that you would use to help you sleep at night. It's going to make you sleepy. But then what you have to keep in mind is, if you're somebody who's waking up several times to go to the bathroom in the middle of the night and you're taking these medications, you might not fully wake up. And even if you think you are, your brain might not be fully awake, and that can increase your risk of falls. There are other medications, for instance, over-the-counter medications like allergy medicines that can also, as side effects, make you a little bit more drowsy or decrease your balance. So be careful also with some of these allergy medications. There are heart medications, blood pressure medications that, again, as we get older, we're more susceptible for dehydration. So if we have a little bit of blood pressure and we're taking blood pressure lowering medications, that could lead to a fall. Again, not saying that if you're taking any of these medications that I just mentioned, don't stop taking them. If you're worried about them, always check in with your doctor and see if they're still appropriate or if there are any reasons to why you should either decrease the dosing or change the medications. Don't go ahead and do that without the appropriate advice from your doctor.
Great. So we also have a question, and I see that Dr. Russell just put something in the chat about it, but we have a question about, are there resources locally or virtually for free Tai Chi classes?
I'm sorry, can you repeat that question?
Are there resources locally for free Tai Chi classes or virtually? And Dr. Russell just put in something from Senior Planet, but if you could say something about that, and then there are a couple of other questions I'll go to after that.
Yes, so I in the chat I also placed some links for, like, Senior Planet is one example of it. The local Council of Aging, you can look at your own local site, and they often offer some exercise programs that are appropriate for older adults. There are the Health and Resilience program through our MGH Dementia Care Collaborative also offers some classes that are open for everyone. Many of these classes are in person, but also often you can find virtual classes where you can do some of these balance and muscle strengthening exercises that you can do from home, and all you need is a chair. So be on the lookout for some of these resources that could be very helpful.
Great. So another question is, are there free or inexpensive alarm systems? They're most pricey for people, especially those on fixed incomes. And I'm going to assume that this is a reference to the kinds of alarms that people wear so that if they are alone and they do fall, they can get help.
Right.
So correct me if
some of these,
yeah.
Yes, so some of these are like the Life Alert, and some of these different brands that you can hang on your neck and put on your wrist. I don't know if there are any specifically free or low budget alarms. Maybe Dr. Russell knows if there are, or if some of them there might be some coverage from insurance that they can help subsidize the cost. But it is something that definitely you should ask your doctor to see if it's appropriate to refer you to use some of these alarm resources.
And I'll add one quick thing. One thing I learned a couple of years ago is that if you have an iPhone, and I don't know if this is true of other types of phones, but if you have an iPhone and you fall, and it feels that impact, it automatically calls 911 and they call you.
Yes, that's a great point. Yes, some of the newer iPhones or the newer like smart watches can detect faults, and if you set it up correctly, it would immediately call 911, and it can also call any emergency contact that you program it to. So look for that feature or have somebody look it up for you. One very important point to make is these devices only detect sudden falls, meaning let's say you're standing, you're walking, and then you fall quickly into the ground, it might detect. But a lot of us at home don't have like a sudden fall. Sometimes it's like you fall, but you're able to grab onto a chair or a wall, and you slowly fall down and end up in the ground. Sometimes even that's like slow falls could end up with a fracture. And sometimes even with those small falls, you won't be able to get up. And those slow falls are typically not detected by these type of devices. So they're good, but they're not 100% effective.
Okay. We have another question about how does the risk for falling vary at different ages? And what are some of the warning signs that you might want to look out for, apart from the sort of all the really sort of physical environment issues that you raised and medications you raised?
Absolutely. Yeah. So basically, the older you get, the higher your risk of falling. As we saw in that graph at the beginning of the fall, the risk increases with aging. It's just because as you get older, there's some changes in your system relating to aging, and also you're probably having more chronic medical conditions, or you need more medications. So all of that increases your risk of falling. What are like red flags that you can is, if you're feeling off balance when you're walking, if you're not feeling that safe anymore, or if you find yourself when you're walking around the house, furniture walking, which is you're holding on to the chair, you're holding on to the table. Every time you change the room, you need to be holding on to something. That probably means that your system is not balancing that well anymore. If again, even if you had a one single fall in the past that you think, you tripped with a curb or you tripped with a rug, always, that's always a red sign that, you need to be checked from your doctor.
Great. Somebody also put in the chat, for those of you that aren't looking at the chat right now, that Beacon Hill Village has classes for members which address balance. And I'd like to ask you to maybe just say a little bit about balance issues and how people can get support for improving their balance.
Right. So again, as we get older, our balance system is often not working that great. There's many reasons why that could happen. So if you think your balance is not as it used to be, always get checked by your doctor, because there's again a ton of different reasons why your balance can be affected. Physical therapy often helps a lot with balancing exercises. As we talked before, Tai Chi is an exercise that really focuses on improving your balance. But even if we do a lot of these things, sometimes we just inevitably have some balance problems. And that's where using appropriate devices like a cane or a walker, depending on your needs, it's very important to use it, as it's there for a reason, right? It's there to help with your balance and to prevent you from falling.
And we also have a comment that I personally agree with and think is very important about creating public service announcements about using assistive devices to help people feel more comfortable using them, because I've had many family members that needed to use a walker or a cane or even be in a wheelchair for periods of time, and they wouldn't do it because they were afraid people were going to, look askance at them or whatever. And it made me very sad, because they could easily be out and about. So I think the more we can destigmatize using devices that really help our quality of life, the better. That's kind of a little infomercial from me, but I'd love your thoughts about this.
I couldn't agree more. Again, it's like using hearing aids or eyeglasses or any assisted device. They're there for a reason. They're there to help correct for some deficits that either because of aging or because of disease. We all get them, and there's a lot of people who really don't use them. It's just because it just makes them look older. It's one thing that I frequently hear, or but again, we know that those kind of assistive devices do help decrease chances of injury. So it just try to get over, as I mentioned, get over your pride. And I'm looking here especially at the men in this group, because we are more proud. Like when we fall harder because we're taking unnecessary risks. But this goes to everyone. Is if you need it, use it, because the risk of a severe injury could be very detrimental.
Well, I have to say, I've always been overjoyed at getting older because it's better than the alternative. So I'm a big fan of getting older in life, even with its challenges. So someone just asked, are 2 poles better to walk with than 1 cane? And actually, I think walking sticks, that's a very good question. Can you say a little bit about that?
Yeah, of course. So walking sticks are great when for people who don't have any specific gait problems or any specific problems. Going out for a walk with 2 walking sticks can be a great support. They might not necessarily be safe in certain type of diseases. So if you have a specific gait disorder or balance disorder or walking disorder, then maybe the walking sticks might not be safe, because you need a little bit more support than a cane with a proper curvature can give you, or using a walker where you have 4 points of support instead of 2 might be a little bit better. So it all depends on your specific needs, and that's why I recommend if you want or if you need, just ask your doctor about it, or ask a physical therapist about it, to do like a proper gait or balance exam, and then they will recommend you the specific device that is going to help you to improve the balance. If you don't have any problems, if you don't have any balance issues, and you frequently go outside for walks, often using walking sticks can be a good additional support.
That's great. And actually, I just want to mention that the concern about public service announcements and assistive devices is not so much because we might be concerned about using them, but it's also how other people react. And, I can share with you I have arthritis, and over the years I've been in a boot or I've been in a cast, and it is shocking to me how many complete strangers will come up and want to know what happened, what did I do, or they want to share with me some horror story about themselves or someone else they know that may have had a similar device. And so I actually think there are a lot of things that public service announcements could do to help with this, especially as our population is aging. People are living longer. So these kinds of things are really important and much more common. And I don't know if there may be anything out there like that.
Yeah. Fortunately, yeah, there's still a lot of stigma around aging in our society, and this is just part of that stigma about getting older and growing older, and there's a lot of what people have opinions about our functional capacity, our cognitive capacity. We've seen that a lot over the last few years, even in our political spheres, about aging, but that's something that we as a society could definitely improve in.
Great, thank you. Somebody asked if we're recording, and yes, these are recorded, and they're posted on the Geriatric Medicine website, the Stokel Center website, and they also go on the Mass General YouTube site. We have our own little YouTube channel, and they go there. So I don't think we have any more questions. I'm going to turn this over to Dr. Russell to see if you have any closing thoughts.
I just want to thank Dr. Franco Garcia for a phenomenal primer where he really did cover in an outstanding way just how common a problem this is and what we can really do to prevent it. I think that fall prevention is a part of most aging service access points. with councils on aging, having fall prevention initiatives, including Tai Chi. If you live in, say, a big city, you can call their Age Strong division in Boston, or check with your local council on aging, and you'll be able to get resources on where these courses are offered, because really you can't. I was going to say you can't swing a dead cat, but I feel like we're not going to talk about that today. But you can't miss Tai Chi classes. They abound in the metro area, and I strongly recommend them. I did my role here today was really just to give everyone an update on the COVID booster. So by now, hopefully you've heard that there is an updated booster shot available for COVID-19. And this covers the recent variant called the FLIRT variant. And we recommend that folks get this, okay? So this is the latest one. The ones before, you might have gotten vaccinated in the spring. This is the updated one. All those other vaccines are passé. This is what the fall lines are offering, direct from Paris. This is the one we want you to have. Similarly, we want to make sure that those over age 65 are getting the high dose flu vaccine. We're ideally looking at mid-October is when you'd get it, mid to late October, because the vaccine efficacy can wane a little bit and flu season can last a little bit longer sometimes. So we're sort of hedging our bets in that regard. But that's the recommendation we have for that. The other big virus, so we talked about flu, we talked about COVID. The other big virus is the respiratory syncytial virus. That vaccine was offered beginning last year. That's a once in a lifetime vaccine. So if you got it last year, you're in the clear. If you haven't gotten it already, you might want to get it because it's a nasty bug. And I think those were the main things here from the virus cubbyhole. But hopefully it'll be a mild season. And then the usual things about, as we get into the colder months, we're going to be washing our hands more. We're going to be judging a little bit more in the public spaces about whether we want a mask or not. But I think if we're all vaccinated, it does a very good job of keeping things down to a dull roar.
And Dr. Russell, I want to ask you a question. Given how COVID has kind of had a resurgence over the summer months, are there any recommendations about how long you have to wait to get the new vaccines after you've actually had COVID?
Yeah, so the CDC was recommending up to 3 months, but then they're saying, oh, whenever you're not testing positive anymore. So I think it's more a matter of what you've been exposed to may not be the prevalent vaccine virus, and we want to make sure that this is the one you're getting immunized for.
Okay. All right. And finally, someone put into the chat that there is free Tai Chi on TV. I think Lee Holden, Holden, is the person who does it. And it's something that anyone can use. And this person is 84 and swears by it. So that is really helpful. Thank you. Thank you. And our next town hall will be October 31st. Anyone wants to come in costume, please do. We may be in costume, and it's going to focus on safe driving. And we also are looking at future topics about loneliness and isolation. And then you heard us mention earlier that the people doing the active brain study, they may come back and talk to us about chronic pain and memory and that sort of thing. And so please send us ideas about topics you'd love to hear about. That's always very helpful to us. And we actually do have one last question, and that is someone just got a flu shot, but they didn't ask for the high dose. What should they do?
Great. So what I would do is, generally speaking, if you're over age 65, they should be automatically giving you the high dose. So you can check with the pharmacy and say, hey, did you give me the high dose the flu vax, the flu zone? And if they didn't, we're not going to recommend you go and get another flu vaccine. It's just sort of like, well, but generally speaking, we want people to get the high dose flu vaccine.
All right. Well, thank you, Dr. Franco Garcia. This was incredibly informative, and I loved your slides. They're very attractive. So thank you. It's wonderful to see everyone, and I hope you can get outside and get some of this sunshine today. Take care.
Thank you.
Bye, folks. Thanks.
Bye-bye.